Sertoli cell-only syndrome, abbreviated SCOS, is a condition where the tiny tubes inside the testicles, seminiferous tubules, contain only Sertoli cells, which normally support sperm development, but no germ cells that actually become sperm. This means the man cannot produce sperm naturally, leading to infertility. Think of a garden where the soil is healthy, Sertoli cells, but there are no seeds, germ, to grow flowers. The causes of SCOS are varied. Some men have genetic problems, such as small deletions on the Y chromosome that act like a missing page in a recipe book. Others may have damage from radiation, chemotherapy, exposure to toxic chemicals like pesticides, infections, or hormonal imbalances. In many cases, the exact cause is unknown, similar to a factory where the machine that makes parts suddenly stops working without a clear reason. Most men with SCOS do not notice any obvious signs. The typical clues appear during a fertility check, when a semen analysis shows no sperm. Some men may have smaller testicles or signs of low testosterone, such as reduced body hair, tiredness, or decreased sex drive. For example, a couple may visit a doctor because they cannot conceive, and the doctor discovers the man's sperm count is 0. Diagnosis combines several steps: a semen test showing no sperm, blood hormone tests, genetic screening for Y chromosome deletions, and a tiny testicular biopsy that reveals only Sertoli cells. Treatment options are limited. Retrieving sperm directly from the testes works only in a small fraction of cases. Most men use assisted reproductive methods with donor sperm, or receive testosterone replacement if hormone levels are low. Imagine a doctor taking a small needle sample from the testicle and looking under a microscope to see only supporting cells. Because many causes are genetic or unknown, prevention focuses on avoiding known risk factors. Men should limit exposure to radiation, for example, wear protective gear during medical imaging, wear proper protection when handling chemicals, treat infections promptly, and avoid unnecessary high-dose anabolic steroids or testosterone that can harm germ cells. Simple habits like using gloves when working with pesticides can reduce the chance of damage. Recent research is trying to give hope to men with SCOS. Scientists are exploring stem cell therapies that could introduce new germ cells into the testicle, and gene editing techniques aim to fix Y chromosome deletions. A newer surgical method called micro-TESE, microsurgical testicular sperm extraction, has improved the chances of finding a few viable sperm in a small percentage of SCOS patients, about 10% in some studies. These advances are still experimental, but point toward possible future treatments.